So welcome everyone to Black DVM Network's topic rounds. Today's rounds are about feline upper respiratory infections, the quote unquote mostly avoidable shelter disease with Dr. Erin Doyle. Feline upper respiratory infections have been, one of the most common diseases of cats and animal shelters. But the great news is that the more we learn about shelter population management and stress reduction, the more we also learn that feline URI isn't inevitable for shelter cats. So tonight we'll be talking all things feline URI. How does it commonly present? How do we treat it? And most importantly, how do we prevent it in the first place? So tonight we have Dr. Erin Doyle to talk to us. And before we let her get started with her presentation, as a small group, we'll go ahead and just introduce ourselves. You can give us, your name, where you are in your vet med journey. So if you're a student, if you're practicing, if you're retired, anything like that. And maybe something that you're hoping to get from tonight's presentation. Does anyone want to start?
I don't mind. Hello, I'm Sharice Roth. I live in Boring, Oregon. It's not an opinion. It is actually a location.
I have heard of it, so you're good.
Just outside of Portland is where I'm at. I am practicing, however, most of the time now I am doing telemedicine. And so that is kind of how we can use that as a way of actually being inclusive of different types of pet population and pet owner populations. I don't remember what else Tiara said to say, but
if there's anything that you were hoping to gain from tonight.
Oh yes, I'm also really kind of interested in these chronic nasal cases. So hopefully there'll be a little something in there regarding those. We try a lot of things like the intranasal vaccines and whatnot, and so just wanting to get a feel for what that looks like at a high volume, high quality location.
Yeah.
Awesome, thank you. So Brianna's writing in the chat. So I'll introduce Brianna. Brianna Brooks, a second year from Houston, Texas at Tuskegee University. And since this is a big topic for shelter medicine, she would like to know some helpful hints for controlling this in clinics also. She is double Zooming right now, which Brianna, props to you. Like you are doing it very, very well. So thanks for being here. And then I'll turn on my video. I'm Tiara. I am a recent grad from Virginia Maryland College of Veterinary Medicine. I currently work in high quality, high volume spay neuter and in serving underserved populations and work right alongside a shelter. So I am hoping to hear about the most up-to-date information on upper respiratory infections.
Nice. Well, I'm excited to chat with everybody, and I would very much love, I have a presentation prepared and a slide deck, which I will start sharing soon, but very much welcome to be as much interactive as possible. So throw your questions out there, can either answer them during or after the presentation, whatever works. And let me share. I will say, so most of my background with feline URI comes from the shelter world. So some of the cases that are more chronic are not cases that I'm managing all the time, but I have a bit to touch on it. And we can totally chat afterwards to kind of complement the bit that I have in the slide deck and dig in a little bit deeper in some of the more chronic conditions. But I'm so happy to be here. Thanks so much, Tara, for inviting me. I could talk about feline shelter medicine for hours and hours and hours. So I will try to keep my talking at you relatively brief because URI in particular is a pretty passion topic of mine, just because I think it's something that we see quite commonly in shelters and in our pet cats, but within the shelter setting, at least as an acquired shelter illness, is again, mostly avoidable. And I think it's been so exciting over the course of my shelter medicine career to see feline health in shelters, and particularly upper respiratory infection, is something that improves so dramatically. speaking of which, here is me. You guys can see me, and apologies that my camera does some weird zooming in and out stuff when the light gets low. I need to fix the lighting in this room, but apologies in advance for any fuzziness. But in case it is blurry for you, here is a picture of me to put face to name. This is me with my daughter. Actually, she's 11 now, and we got as lucky as one can get in that we took a February vacation last year to Italy before the world shut down. So we were so fortunate to be in Italy. And so I've kept this slide when I give presentations in my slide deck, because it's lovely to relive. And again, we were so fortunate to be able to travel once just before traveling became less possible. And speaking of travel, that's a lot of what I do with my work. I am a senior director of shelter medicine and residency programs at the ASPCA. So our department helps to support other internal departments at the ASPCA as well as external partners. So I work from home and I'm on the road traveling to our partners. Especially, I do a lot of work with our New York City shelters, our adoption center and our kid nursery. So when we get to questions, happy to talk about anything and everything shelter medicine, especially feline shelter medicine. Before joining the ASPCA, I was at the Ann School of Boston for almost 11 years and was in private practice before that. And I still am affiliated with the Cummings School of Veterinary Medicine at Tufts University. I love any chance that I can interacting with veterinary students and teaching, and so help out with their elective course in shelter medicine for the veterinary students. And for those that heard Pierre and I talking a bit earlier, I also have connections to the ASV, so I will put a plug in for Association of Shelter Veterinarians membership. It's a great organization. Dr. Jim Aziz is leading it now, and I so admire the work she's doing with the organization to continue to kind of increase perks for members. And so if you have any part of your work involves any shelter work, whether it's through private practice or because you are working in a shelter, definitely we'll put a plug in for membership. So for today, again, I'm going to try to kind of buzz through my slides relatively quickly because I would love to open up for discussion as soon as we can. So I'm just going to hit the highlights of URI. I think getting at some of what folks are most interested in, and I'll try to keep that in mind as I go through. But again, we'll discuss after too, anything that I don't quite hit on in enough detail, but just a broad overview of upper respiratory infection in cats. Again, my perspective is largely focusing on in-shelter upper respiratory infection, but there's a lot of overlap, of course, between private practice and what we're seeing in pet cats and what we're seeing in the shelter, just sort of some different presentations related to the different settings. And so when we talk treatment and diagnostics and so on, there will certainly be a lot of overlap regardless of practice type. That said, coming from a shelter background, and this is a little different than the chronic URI that you might see in a owned cat, but when we're talking shelter and acute URI, particularly in adult cats, we're really talking a disease of stress and confinement. And so this is where I get on a soapbox in the shelter setting to remember that URI is not inevitable, again, particularly in our adult cats, because you don't tend to see a lot of healthy cats out in the world, whether they're in homes, whether they are community cats. You don't tend to see a lot of otherwise healthy cats sick with upper respiratory. It's something we tend to see in our kittens, in our cats with underlying disease, or in our cats that are stressed and confined. And so that's kind of my soapbox about URI, again, particularly in the shelter setting, is that oftentimes it is something avoidable because it's something more related to the setting than so much something that's inevitable. So there's a lot on the slide. Sorry, we're going to kind of overview of etiologic agents again, just to give some background. And there's a lot on here, although really those top two, feline herpes virus and feline calicivirus, are really what we're primarily thinking of as our etiologic agents for URI. This is primarily a viral disease. We'll talk treatment and why antibiotics still has a role, but we're really mostly talking viral. And feline herpes virus is the most common agent for URI, and as we know, it causes a latent infection. It's specific to cats, feline herpes virus, but as all all herpes virus behaves the same way in that after infection, it can become latently present in the nervous system and recrudesce to cause infections. And that's how we're seeing it most commonly in the shelter in our adult cats, is recrudescent infection related to stress. There have been studies that show up to 80 to 90% of cats have been exposed to herpes virus. So it's something that most cats are exposed to and have had. Time when you might be seeing it kind of more likely to be the primary infection rather than the recrudescence is in our kittens, who are sometimes getting exposed for the first time. And all of this matters because how we're talking about treatment and isolation and prevention all ties into what we're likely to be seeing. So we're seeing stress and herpes infection.
Hi, Dr. Doyle. It seems like we might have lost your audio, or maybe that was just me.
I did lose it as well.
Hopefully, let me know in the chat.
And thanks for
look on my headphones. So that's feeling herpes virus. In terms of clinical signs,
Dr. Doyle, we still don't have audio for you.
Although one thing with
She can hear us.
infection in cats is that even though there are some.
Hey, Dr. Doyle. We lost audio for you a couple minutes back. Okay, so she's just switching to computer audio. Like we could hear you, but it was just very distant, like fading. So
My headphones just suddenly cut out, so I'm so sorry for that. Let me share again, and hopefully the computer audio is working okay. My best laid plans to improve the audio by using my headphones were
no, totally fine. That's totally fine.
All right, back again after that brief interruption. So that's feline herpes virus. So again, you're most common if you're seeing it show up in a shelter cat who's gotten sick while they're in the shelter. If you're seeing a cat, there's been studies that show if you're doing a high quality spay neuter, and you are, especially if you're doing any TNR for community cats that might be sick in that context also are most commonly affected by herpes virus. So it's a most common cause. But a close runner-up is feline calicivirus. That same study that showed some prevalence depending on different cat populations showed that feline calicivirus is what you're most likely to see in your overcrowding settings or your chronic stress settings. So things like hoarding houses, long-term rescues, either sanctuaries or rescues where you've got cats staying for a long period of time. That's where you're more likely to see calicivirus, but it also can be a player in upper respiratory infection in any cat, and certainly in our kittens as well. Feline calicivirus does not cause a latent infection, but they can shed for an extended period of time. So it can be a little bit blurry in terms of you can see cats sort of have this prolonged period where they can be in a situation like a hoarding setting and potentially kind of go in and out of clinical signs, but you're not going to see it be something that is triggered by stress in an otherwise healthy adult cat because it doesn't have that latent period. And tends to cause oral signs. Feline calicivirus is sort of typically implicated with oral ulcerations on the tongue, as well as nasal congestion, but there's a lot of overlap. You can see feline calicivirus cause conjunctivitis. You can see feline herpes virus cause oral lesions. And so ultimately you can make some educated guesses about what your etiologic agent is, but there's a tremendous amount of overlap and it's hard to tell for sure. Thankfully, it usually doesn't matter. And we'll talk a little bit about diagnostics and when they're indicated, but most of the time you're going to manage and treat the cat pretty similarly, regardless of what the etiologic agent is. There are a few primary bacterial agents that cause URI without any other players involved: chlamydia, mycoplasma, and bordetella. They're not nearly as common. Most of the time you're talking herpes and calicivirus, and secondary bacterial agents, which can be relatively common. And that's why antibiotics still have a role, even in our run-of-the-mill upper respiratory, is primarily to treat that secondary bacterial infection, which tends to just be the normal nasal flora, kind of overgrowing because of the damage to the nasal turbinates. I wanted to, just because of the time we're in, I thought it felt like it was pertinent to mention COVID-19 and cats, since we're talking about respiratory disease in cats and etiologic agents, and just mention that I think at this stage in the pandemic, we're a lot more familiar with how COVID-19 impacts our companion animals. And so this might be old information, but I thought it was worth just reviewing that COVID-19 can cause clinical signs in cats, and that can be respiratory signs. It's exceedingly much more common for it to be our routine pathogens like herpes and calicivirus, but it is a possibility in a cat that has known exposure to a human with clinical signs of COVID-19. There has been experimental documentation of transmission cat to cat of COVID, but it has not been documented cat to human. So these are by and large the cats that have tested positive are cats that have that exposure to infected humans. So it's really only something you're thinking about if you have that known exposure history. And recommendation is still, if you have a cat who is symptomatic and has been exposed based on their human contact history, recommendation, if you're thinking about testing for it, is still to seek public health guidance prior to testing. Because again, by and large, cats that are sick, even though we know they can get affected by COVID-19, are still by and large sick for our more run-of-the-mill causes. But I just wanted to mention, because it felt like an elephant in the room, not to mention nowadays this potential for illness in cats. Back to our regular URI. So we got a little bit into the chronic symptoms, because I know that was something that you had mentioned, Dr. Roth, but just to talk briefly about what we commonly see in our acute upper respiratory. And many of you have likely seen this, and so a lot of this might be a review of information that you've certainly seen in your patients. But most commonly, of course, you're seeing things like ocular and nasal discharge, nasal congestion. I mentioned oral ulceration, more common with calicivirus, but can happen with both of our viral causes, keratitis and corneal ulceration. Now, once you start to see more severe ocular symptoms like that, you are more likely dealing with herpes virus. Once it gets is lameness. Many of you may have seen, but you'll see a kitten come in that comes in acutely lame, no abnormalities in orthopedic exam, and one main rule out to consider is feline calicivirus. And the good news is it's often self-limiting, so it's really not a bad diagnosis to make in a lame kitten, as opposed to some sort of more musculoskeletal trauma or other cause. But it's definitely something that I have seen not uncommonly over my years. Similarly, gastrointestinal signs actually are something that I will see not uncommonly, whether they are strictly caused by the same etiologic agent or just happen to go hand in hand in terms of disease, that things that are caused by stress and confinement in cats, both gastrointestinal signs as well as upper respiratory, fall into that category. But in practice, particularly in a shelter setting, I have definitely seen, you'll see cats have some vomiting and diarrhea, about 24 to 48 hours before they start to break with URI. So it's anecdotal, but definitely something that both myself and I've heard colleagues describe as well. Now, some more chronic changes. So the cat in the photo is one from my practice days at the Animal Rescue League. This was actually a cat from a hoarding situation. And this cat has phthisis bulbi. So that's when you have the shrunken globe, which is often caused by previous perforating corneal ulceration, which can happen with severe upper respiratory, particularly in kittens. And so this is oftentimes the clinical history that we often presume, because oftentimes we don't know the exact history for some of these cats, but is that when they were kittens, they've had a perforating corneal ulcer that caused such severe damage to the globe that it basically is shrunken and completely non-functional. And my recommendation with these cats is to enucleate, because there's, again, it's a non-functional eye. And as you can kind of see, that photo is a little bit blurry, but you can probably see a bit that the you're seeing some secondary entropy on there. And so you can get chronic ocular discharge related to that. Another chronic ocular sign that you'll see related to a history of acute upper respiratory infection is symblepharon. I don't know if you guys have seen this in practice, and I didn't have a great photo to share, but it's basically when the conjunctiva adheres to the cornea. And that can be either a mild film that is sort of barely noticeable, which you just happen to notice that the limbic junction is unclear, or it can be really severe and completely covering the eye and preventing vision in that eye. And similarly, symblepharon is related to a prior severe upper respiratory infection affecting the eye with severe conjunctivitis and ocular signs. So when we're seeing something like symblepharon, it's not an active change, it's the sequela to a previous severe infection, again, oftentimes when they're little, and that's why it causes the conjunctiva to adhere. As you mentioned, Dr. Roth, one sign that we can see with upper respiratory is that chronic nasal or ocular inflammation. Again, my perspective has largely been from the shelter world, so I encounter cats that are with us for an extended period of time, particularly if they're in foster care and they have these chronic signs that we're having a little bit of challenge resolving. And back in my practice days, when I was in private practice, encountered these cats on the other side, on the practitioner side of things. My thought with these cats is that it can be multifactorial. There's different potential causes for these chronic signs. For sometimes for our cats in a shelter setting, it can be not so much that it's chronic in terms of a lifelong condition, just that it's taking a long time to resolve, particularly for cats that might have ongoing stress in the shelter setting. So sometimes it is truly just a longer manifestation of an acute disease, but sometimes we're seeing chronic nasal discharge because of ongoing viral infection. That is one presentation, particularly of herpes virus, where you're seeing that chronic kind of continuous recrudescence of that latent infection. I have also seen cats with chronic nasal congestion related to turbinate damage. Basically, they've just had such severe of an upper respiratory, and you'll see this particularly, I think, in some of your cats that come from overcrowding situations, like hoarding situations, where there's just enough damage to the nasal turbinates in the nose that it causes that chronic nasal congestion. That can be the most kind of challenging to try to resolve, although if it's mild, it may be something that isn't really impairing quality of life, and so they might be okay to just live with it. And then last but not least, you can see persistent nasal discharge related to nasopharyngeal polyps, which can definitely occur secondary to upper respiratory because of all the inflammation. So we can touch on that a little bit with treatment, but again, we can dig back into some of the more chronic conditions with the questions once we get to the end, if you'd like. But just kind of, again, with a basic overview of upper respiratory, I definitely wanted to mention transmission, right? Because this is an infectious disease. And so particularly when we're talking in a shelter setting, although also if we've got pet cats affected in a multi-cat household, it's important to know how it's transmitted. And you'll notice one of the transmission methods is sort of not, it's a bit of a cheat on my part because it's not really a transmission method, but just a reminder that for a lot of adult cats that are sick with upper respiratory signs, particularly if they're otherwise healthy or coming from, either just regularly in a shelter or in a stable home, we're seeing a recrudescent of their latent herpes infection. And because most cats are exposed already to herpes, it's not necessarily something that we worry as much about transmission in those type situations where you have two, when you have healthy adult cats and you suspect a recrudescence of herpes. But all that to say, both herpes and calici are spread primarily via fomite, via droplet transmission, or via direct contact. So if you're in a shelter setting and you have cats that are sick with upper respiratory infection, you can potentially spread disease through your hands, the most common fomite. If a cat physically sneezes and you get those respiratory droplets onto another cat, the good news though is that they can only sneeze up to 6 feet maximum, and so they have to be pretty, in pretty close proximity to one another to have droplet transmission be a risk. And then of course direct contact, cat to cat. What you'll notice missing is aerosolization. Feline upper respiratory infection is not spread, does not become airborne, and does not spread in that manner the way kennel cough does for dogs. So these are all kind of good signs in terms of how we talk about preventing transmission in shelters, because we can do it pretty readily with just some pretty simple precautions, even sometimes without having to move cats around into isolation spaces, but sort of isolating them where they are, which, because of the stress cats experience whenever they move, is always a good thing if we can try to keep as much stability as possible. So talking diagnostics, which I mentioned a bit before. So even though based on clinical science, we're not always going to know what our underlying cause is. We can guess herpes, we can guess calici, we can make educated guess based on their history. Most of the time that doesn't matter. We'll talk treatment next, and generally speaking, you're using a lot of the same treatment approaches and management approaches, regardless of what you're dealing with. When you might want to consider diagnostics are if you have unusual or severe clinical signs in an individual cat, if you're talking shelter and you have a higher incidence than normal in your shelter, or if you have a lot of respiratory disease in your shelter and want to just do some surveillance and see what you have, what tends to be the pathogens you're worried about. The tricky thing with diagnostics is that my go-to diagnostic for feline upper respiratory is a respiratory PCR panel. You can get them through IDEXX and Antec. They're just based on the nasal swab. They're pretty easy to do. The catch is that you don't always know for sure what is causing the disease in an individual cat, because herpes and calici are so common, because herpes is something that even an otherwise healthy cat can have latently and can sometimes shed. You can get positive results that aren't necessarily causing disease in the cat, and vice versa. You can get negative results due to intermittent shedding for whatever might be causing that disease in the cat. So they can be a useful tool, but they're not the end all be all to tell you what's going on. So again, in most cases of routine URI, they're not necessary and aren't necessarily going to give you enough information to make it worthwhile. But if you are pursuing them, they can be valuable again for surveillance, or if you have a really unusual presentation. Similarly, if you have a cat that is presenting with more severe clinical signs than normal, or there's an unusual presentation, things like radiographs and culture and sensitivity can be useful. Don't do them a ton, because it really would be if there's something unusual going on. Even for cats with lower respiratory symptoms where you're suspecting pneumonia, oftentimes you can treat presumptively and not necessarily need the radiographs, particularly if you're in a setting where either due to client considerations, or if you're watching resources for a shelter or a high volume clinic, radiographs don't necessarily give you that information that's going to change your treatment plan, even if you are suspecting lower respiratory tract disease. So more often than not, I am treating presumptively when I see a cat with URI. So there's a lot of information here as well. And we can dig into doses and more specifics based on whatever folks are interested in. But just to give you an overview of how I treat upper respiratory, and especially when we're talking shelter, where stress is going to be a major trigger, but this applies in a home setting as well. Reducing stress is treatment number one. Again, this is a disease not unlike upper respiratory in people, where fundamentally, if we rest and take a break, it can go a long way towards resolving symptoms, and the same for our cats. So in a shelter setting, foster care is invaluable to treat upper respiratory, as well as reducing environmental stressors and providing enrichment. And we can get into more detail about details there, but just overall making the cat's experience less stressful is going to go a long way towards preventing, as we'll talk about, but also treating upper respiratory infection. Supportive care is critical as well. I am a fan of fluid support and using sub-Q fluids for cats with URI, particularly if they're febrile or not eating that great. Sometimes even just though if it's really severe nasal congestion, even if they don't have other signs, I think sub-Q fluids can be a huge help, as well as, of course, tempting them to eat. And sometimes I will use appetite stimulants if I need to. In a shelter situation, I find often that we can try to get ahead of that through prevention of URI or catching it early. But certainly I have used drugs like mirtazapine as well to help stimulate appetite if you've got a cat that's particularly sort of struggling to get them back on food, even as we're managing their other signs. But speaking of managing clinical signs, I will use antibiotics. Again, we are talking viral illness, we're talking herpes and calicivirus, but because of those secondary bacterial pathogens or that less likely but possible potential that it is a primary bacterial pathogen, I will treat with antibiotics. I don't treat every cat with antibiotics. Tend to treat kittens with antibiotics sooner rather than later because they are more fragile and a bit more prone to the lower respiratory tract disease. I will treat cats with really severe nasal congestion or discharge, or cats that are showing more severe symptoms otherwise, like more significant lethargy or inappetence. And my go-to antibiotic is doxycycline. You want to use compounded liquid is ideal, because if you're using a pill and you pill the cat, if it gets caught in the esophagus, it can cause esophageal stricture. So I tend to use compounded liquid doxycycline, which is pretty readily available and works pretty well. There are studies that show that Clavamox is just as effective for, or amoxicillin, just as effective for upper respiratory infection. Disadvantage is you have to give it twice a day as compared to the once daily for the doxy. And doxy, because it has some anti-inflammatory properties, can resolve that nasal congestion a bit quicker. But you can use Clavamox, particularly if you've got something else you're treating as well, like a skin wound, if you've got a little kitten with moisture dermatitis from diarrhea and you want to kind of cover both at the same time, Clavamox works. Or azithromycin. Azithromycin is actually my second choice beyond doxy. Typically, if I've got an animal in a shelter setting with an acute infection that's not resolving, I like to first make sure I'm using all of those stress reduction techniques. But if a cat has been on doxy without response, and I'm doing everything else I can, and the cat isn't responding, then I will sometimes switch to azithromycin. Topical ophthalmic treatments are kind of optional in a lot of cases, I find. If you've got them on oral antibiotics, the conjunctiva has really good vasculature, and so you can get away with just using the oral, and oftentimes cats tolerate that a bit better than topical treatment on the eyes. I have used for cats that do tolerate it, particularly for kittens. I worked with one ophthalmologist who recommended just using an artificial lubricant. We used to use Genteel a lot just to help keep the cornea healthy with severe conjunctivitis, combined with oral doxycycline. Or certainly something like terramycin is an option. If you've got cats on it for a really long time, it can cause irritation to the eye. So again, I'm usually pairing it with an oral antibiotic or just sticking with the oral antibiotic. But in severe conjunctivitis, particularly in your little kittens, we'll certainly use some topical antibiotics like terramycin. And I also like to consider analgesia and anti-inflammatories, particularly if you've got a cat that's febrile, a cat that has oral lesions, a cat that has severe conjunctivitis. I will use NSAIDs, we'll use buprenorphine to help alleviate symptoms. I think that can go a long way towards helping with inappetence and some of the other signs we might see. Antivirals are not something that I reach for very often at all. Right, like we're treating viral infection, but most of the time we're just kind of letting the immune system handle the viral infection while we do all the rest. So famciclovir has been used in cats. It has been shown to be effective for herpes virus in cats. Clinically, I don't find it to be sort of the silver bullet. And so for me, it's not something that I reach for hardly ever for treating URI. Not that it doesn't have any role, but again, it certainly, I don't think works magic. And less is more often when we're trying to medicate cats. Cidofovir as an ocular treatment, I will use sometimes for really severe ocular signs. So again, I'm not reaching for it commonly at all. Usually I'm just using my supportive care even with really nasty conjunctivitis, but sometimes if you're seeing corneal ulceration or other severe signs in the eye, I will use cidofovir. It's pretty expensive, and so that's the downside in terms of either prescribing it for a client or for keeping it on the shelf if you're stocking it in a shelter. For those chronic cases, again, I think there's a number of different treatment options that I have used, and it's not as common that I'm managing those cases in a shelter setting. I have actually used sedated nasal flushes and found those to be somewhat successful. It's a holdover from my private practice days when one of the veterinarians who owned the practice, that was his go-to for these cats, and have found some symptomatic relief that actually lasts for a fair bit with that. Typically, I have them under because I'm looking for a polyp or looking for something else, and sort of do a nasal flush while I'm there, and have found that to provide some symptomatic relief. Lysine is not on the slide because I had this mostly focused on sort of a shelter setting. And there's been studies that show that lysine in the food as a supplement does not work well for preventing URI or treating it acutely, but it can be helpful for those long-term chronic cases. So that is something you'll also consider for chronic URI management. Although again, I wish that I had a better solution, and I don't, because I think it can be multifactorial. And some of the factors like that nasal turbinate damage can be hard to really address. And so sometimes we are just living with the clinical signs in those situations. But again, we can talk more as we get to the end. Last but not least, just a couple slides on prevention. Again, this is largely focused on the shelter setting, where really preventing URI is a lot about enhancing population management. Getting cats in and out the door as much as is reasonable for your shelter. Keeping that kind of flow through of cats from intake to adoption goes a long way towards reducing overcrowding in the population in the shelter, as well as operating within capacity for care as a shelter. And cats do well when they're in appropriate housing. This is kind of a creme de la creme housing picture from a shelter in upstate New York that was able to renovate their whole cat adoption area. But even in a shelter that doesn't have this sort of lovely housing, just creating portals to make multi-compartment housing for your cats can go a long way towards reducing stress, which in turn can prevent URI. And of course, things like enrichment, reducing environmental stressors, maintaining a regular routine. Cats love to feel like they have control over what's happening to them and know what's coming. And that goes a long way towards reducing their stress. And of course, low stress handling. In terms of just mitigating our stressful touch points with these cats can make a huge difference. Vaccination is definitely another part of prevention. It is not the end all be all. It's not going to completely prevent clinical disease from URI, but it can reduce the severity of symptoms. And especially for our little ones that might not have been exposed yet. For kittens, FVRCP vaccination is particularly critical. Not to mention the pandemic part of it, which of course is incredibly vital, but it has a role for upper respiratory as well as just regular preventive care, deworming, flea and tick treatment. Overall, healthier cats without other underlying disease are less likely to get sick from URI. And so it all goes hand in hand. As well as reducing exposure through reducing length of stay in the shelter, avoiding overcrowding, keeping those vulnerable ones, those little kittens, separate. Isolating affected cats sometimes. As I said, as we talked about with transmission, this is not something that aerosolizes URI. And for a lot of our adult cats, we're seeing recrudescence of herpes. We're not necessarily seeing them get sick because they've been exposed from another cat. And cats get really stressed when they move around in cages. Cats like to know what's coming. They like to know their environment, and they like to feel like they have some control. And so keeping them where they are, if you're in a shelter or in a foster home, goes a long way towards reducing stress. And so I will oftentimes keep cats where they are and just isolate them in place, so to speak, and use other biosecurity measures, make sure people are washing their hands, avoid having high risk like kittens near them, and let them stay where they are and continue towards adoption. And again, of course, just the simple stuff like washing your hands, whether you're seeing a patient in the clinic or whether you're in the shelter, that always goes a long way. But in summary, and then I will stop talking and open it up for discussion. You're dealing with primarily herpes virus and calicivirus. It is a disease of confinement and stress in our shelter cats or in our high volume TNR cats. Oftentimes when you're seeing cats come into those settings sick, there's a good chance either there's something else going on, or it's because they've already been confined and trapped for a little while, and that's made them stressed and get more sick. And again, in that case, it's usually self-limiting. In a shelter, endemic URI is an indicator of population management concerns. It's easier said than done to completely fix that and get animals kind of moving in and out quickly, but that's where we should look for prevention. Treatment can be conservative, right? It's a stress reduction, it's that supportive care, using the antibiotics when you need to, but oftentimes if you're doing that stress reduction, you can go a long way towards preventing and treating URI. And again, in a shelter setting, you can really focus on prevention and make a huge difference in the health of the shelter cats through some pretty simple stress reduction and population management techniques. And last but not least, this is my cat. I share an office space with him. He is why I have to keep the office door open despite the background noise, or else he will bang on the door, because this is where his litter box and food is. That's when he was a tiny kitten, and I brought him in when I was in private practice way back in Worcester, Massachusetts, more long ago than I want to admit. And this is actually getting to be a bit of a dated picture. He's now 15 and a half. So that is Edward. And with that, I will stop sharing so we can chat and open it up to questions.
Awesome. Thank you so much. That was such an informative presentation. There are some questions in the chat, and we can start with those. Or if anyone who asked a question in the chat wants to come off mute and ask their question, feel free to.
I'm happy to. Hi, Erin. Thank you so much. I thought that was really informative and a very nice covering of just kind of all of the things that you guys get the pleasure of seeing in shelter medicine. I had two primary questions for you. I know that you said that doxy is your drug of choice. I'm always a little hesitant to use that in the growing kitties because of the issues it can cause with growth plates. Have you actually seen any of that happen, or do you feel like it's I don't know, I've never actually seen it, but they definitely beat it into us in school, right?
Yeah, it's a great question. I'm glad you mentioned it. And no, I have not seen it happen. And I don't know the research off the top of my head, but there is some evidence to support its use and that it's okay. And so no, I am very comfortable with it in kittens, and we'll use it very young. I've used it in tiny neonates. I don't really have you're mostly seeing it sort of 3 weeks and up that it's starting to present, but I have used it in kittens that small. Same 10 mg per kg dosing that I'll use. Again, using the compounded liquid, because I think once you get into the tablets, then you start to get into issues. Not that I have seen that firsthand. When I first started in shelter practice and was using doxy more, we were using tablets and then a chaser of water, which is A, miserable for everybody involved. Definitely the cat, and B, still feels a bit risky. And so, but with using that compounded liquid, I've been very comfortable with its use, including in the little ones. So definitely.
My only other question for you was, I know it's off label, and let's all pretend that I don't work for Zoetis for a second, because I definitely been guilty of using this. Have you seen any promising results, or have you guys tried using Cerenia as for those chronic nasal discharge kitties, and have you seen any success with it?
It's a really great question. And, I have dabbled a little bit, and it's always hard because it's just sort of dabbling. And so I haven't seen it be a miracle worker, but I'm a big fan of Cerenia. And so, I don't know. It's not something that I've tried in a very consistent way. It's usually been if there's been some other reason to think about it. Again, sometimes I'm seeing that sort of GI URI combination in signs. And thinking about research that's out there, there is nothing I have seen recently, although I can take a peek and look back into see if there's anyone out there talking about it. So I'm interested and still intrigued because of some anti-inflammatory properties, but it's not something I have necessarily clinically seen kind of do a ton for, but I think that's mostly that's a small kind of anecdotal impression. So I'm interested in it. Have you used it?
Just spotty, just every once in a while I'll try it, but I've not seen anything convincing. But I feel like I've always seen people, mostly in social, saying, oh yeah, I use Cerenia nasal drops, but I've never actually seen this amazing clinical outcome from it. And so I was curious if you had.
I haven't. I mean, to be honest, I feel like this happens in a lot of feline meds. There's nothing I've really seen be the like amazing thing for a clinic. Like I've seen amazing prevention in shelters, but once you've got that clinical cat, I mean, I use all of the stuff, right? The doxy, and then, I certainly see it work, but I don't find anything to be the sort of kind of treatment. Like I feel like famciclovir was talked about for a little bit, like, oh, it makes sense, right? It's antiviral, and I've been really underwhelmed when I've tried to use famciclovir, which is disappointing.
I've used a lot of like ophthalmic solutions for topical in the nose, and I feel like that does a good job as long as it's got a bit of a steroid in it. But yeah, none of these kind of anecdotal ones really seem to do much. Thank you for sharing that. I appreciate it.
No, not at all. I wish I had a better solution, but I feel like it's when you talk about the other topic that I feel like this happens is kitten diarrhea. I want to have the answer, and I never do. I never do. It's still a bit of a conundrum.
I hear you have to actually roll the cat in panazeral is how you get rid of.
Apparently. Throw all the dewormers at them.
Yep. Thank you so much. I thought this was great. I have to pop off for another call, but I really appreciate your time and your expertise.
Well, it was lovely to meet you. Thanks for joining.
Yeah, thanks.
Bye. Thanks for hopping on.
Yeah, my pleasure. Good night, Elise.
Good night. So I'm not sure, this is just kind of going over my head, but can you kind of backtrack a little bit about why you would use Cerenia off-label for URI kitties? I heard you guys talking about anti-inflammatory properties, but
yeah, and it's a good point. And I don't, there's a lot of the pharmacokinetics that will be over my head to explain. I should know better than what I do. I should probably go look it up, but it really falls into that anti-inflammatory kind of catch-all use of Cerenia. I have tried it for all sorts of different things. Like I feel like sometimes it falls into some of the, talking about it with postoperative pain management and how it can potentially help with some of the analgesia or anti-inflammatory. And I should go back and double check the literature, but I haven't seen studies that necessarily support that. It's been all anecdotal. So it sort of falls more into that general anti-inflammatory category. And it really, I think it is more for that chronic case management, which I will totally admit I'm not doing a ton of. I am mostly doing more of the kind of, shorter term management, whether they're in the shelter or whether it's, kind of through the clinic or whatnot. But yeah, so